Soluble Urokinase receptor and chronic kidney disease. Well, chronic kidney disease is a progressive loss of kidney function considered a major public health problem affecting 11% of the United States population. Patients with chronic kidney disease are at high risk for cardiovascular disease and death. In clinical practice, methods of screening for kidney disease are limited to measure of urinary protein excretion and calculation of the estimate glomerular filtration and rate.
Hello, my name is Dr. Kidney, and your doctor has asked me to explain to you what it means to have CKD. CKD stands for chronic kidney disease. By better understanding what it means to have CKD, you and your medical team will be in a much better position to take care of your kidneys. By the end of this short presentation, you should clearly understand the importance of knowing the answers to these three basic questions concerning your kidneys. Number 1, what percentage are my kidneys working at? Number 2, why are my kidneys weak? And number 3, how can I protect my kidneys? Your doctor will perform a series of tests that will allow him to answer these questions so you can better understand what your kidney situation is. You have 2 kidneys, and their main job is to continuously clean the blood and regulate the fluids and electrolytes in the blood. The heart, which acts as a big pump, sends blood to all your body parts. 20% of all the blood pumped out of the heart with each beat goes to the kidneys. Now, let's take a closer look at the kidney system. You have 2 kidney arteries which deliver the blood to the kidneys. The kidneys themselves act as filtering machines that clean the blood. The clean blood coming out of the kidneys is then delivered back to the heart by the kidney veins. The urine, which is actually made in the kidneys, is delivered to the bladder. The ureters are the 2 straw-like structures that connect the kidneys to the bladder. The urine is stored in the bladder. The bladder acts like a muscle sac that will then contract and expels the urine out into the toilet through another small tube called the urethra. Men and women have different anatomy that allows the urine to exit the body. In men, the prostate gland surrounds the urethra and can grow in size and cause partial blockage of the urethra. The kidney cartoon is a simple picture of the kidney system. It shows the kidney arteries delivering the blood to the kidneys. The kidneys clean the blood and deliver it to the bladder via the ureters. The bladder stores the urine until it contracts and pees it out into the toilet. The urologist, who is often referred to as a plumber, is a special doctor that takes care of the plumbing part of the kidney system. This includes the ureters, bladder, and urethra. He is a hands-on type of doctor who uses instruments to go up inside the urethra, bladder, or ureter to deal with blockages. In men, the prostate gland often becomes enlarged and can cause blockages of the urethra. The urologist may need to do a rotor-rooter job to open up the blockage. The nephrologist, who is often referred to as the engineer of the kidneys, is involved with the evaluation and treatment of diseases that cause CKD. Now that we have reviewed the anatomy of the kidney system, let's focus on the three important questions concerning your CKD. First, it is important to realize that CKD is a very, very common problem in the U.S. There are over 25 million people in the U.S. with CKD.
We'll continue. The issue applied in Latin America. Serum creatinine measures are enrolled and all sequences measure obtained during routine following clinic disease or hospitalization with the MRI health system were recorded. The eGFR was calculated by means of the chronic disease epidemiological evaluation equation.
Amager Hospital er et af landets største akuthospitaler. 85% af alle vores patienter er akut indlagt, og det betyder, at forskning af akutte patienter bliver mere og mere vigtig.
Henriette Nielsen ankommer til akutmodtagelsen efter hun er besvimet derhjemme. Hun får taget en stribe blodprøver, og en af dem er en såkaldt supertest.
Super er protein i blodet, der siger noget om patientens risiko. Og det er faktisk en test, som vi har udviklet her på Hvidovre Hospital.
Super kan være med til at give en helhedsvurdering af patienten inden for det første døgn, for at skærpe opmærksomheden på, om denne her patient fejler mere andet end det, der stod på indlæggelsessedlen. Så scanner vi.
Super stiller altså ikke en diagnose, men tallet for superniveauet kan, lidt firkantet sagt, give en indikation af, hvor presset kroppen er. Testen kan afsløre tegn på alvorlig sygdom.
Populært kan man sige, at det ligesom er immunforsvarets sprog, vi faktisk måler på.
Ja, jeg følte mig meget svimmel, men...
Hvis immunforsvaret er enormt aktiveret, så alle cellerne aktiverer hinanden. Det gør ikke at udsende nogle proteiner fra en celle til en anden celle, der aktiverer den og siger, gå til angreb og angriber. Det er et udtryk for alarmberedskabet, kroppen vi måler på. Hvis det er meget højt, og det er det typisk med cancer og hjertekarsygdom og forskellige tilstande. Når der virkelig er noget galt, så er der altså kraftig immunaktivering, kraftig inflammation, om du vil. Når vi super er lav i blodprøven, er risikoen for alvorlig sygdom til stede meget lille. Det understøtter så også den kliniske beslutning om at udskrive patienten eller hjemsende patienten.
Henriette Nielsens blodprøve bliver nu sendt til klinisk biokemisk afdeling.
Nogle gange overrasker den os. Og for eksempel en kvinde, som var 48 år, som vi havde egentlig afsluttet udredningen. Men så vi, super var meget høj, undersøgte hende yderligere, så fandt vi, at hun havde en tumor i sin nyre. Så blev hun så umiddelbart opereret. Her var der ligesom en test, som gav os noget indikation af, at der var altså noget alvorligt galt her, og vi skulle gøre noget ved det.
Forskningsprojektet omkring super er ikke afsluttet endnu, men testen er ved at blive taget i brug på flere akutmodtagelser i Region Hovedstaden. Henriette Nielsens supertest viser sig at være i den høje ende.
Men med det opsalder, så kunne vi godt tænke os at lige observere dig i døgns tid. Så skal vi have undersøgt din hjerterytme de næste døgn. Vi er gode, men vi kan blive bedre. Og det er projekter som Super, der skal hjælpe os til at blive Danmarks bedste akuthospital.
Well, the relationship between eGFR, proteinuria, and sulfur levels are flat. A lower eGFR at the baseline was independently associated with decreased age, male sex, black race, higher body mass index, a history of smoking, hypertension, proteinuria, non-announced renin angiotensin system inhibitors, and elevated PRL levels.
Hi, welcome to our show Expert Speak. Today we have with us Dr. Deepa Jayaram. She is a renowned consultant in nephrology and transplantology. Today she will talk to us about the common ailments of the kidney and associated illnesses. Doctor, could you tell us what are the kidney problems that people need to be aware of? And how could people suspect they have them? Are there any signs and symptoms that people need to be aware about?
Kidney disease sometimes can come without any presenting signs and symptoms unless and until it is very advanced in stage, at which time the patient can present with symptoms related to the buildup of all the waste materials in the body. This can lead to symptoms like lack of concentration, generalized fatigue, feeling very weak, no appetite, nausea, vomiting, increased itching all over the body. And in addition, because your kidneys play an important role in removing the excess salt and water from your body, the patients can present with symptoms like swelling. This can be noticed either over the feet, the legs, or it could be puffiness of the face, tightness of the hands. And if the fluid tends to start getting built up in the lungs, then the patient can have symptoms of breathlessness because of the volume overload. In addition, specifically symptoms pertaining to the kidney and urinary tract can also be present. For instance, the patient could have blood in the urine. They could see a lot of bubbles in the urine or foamy urine, which could be a sign of protein leakage in the urine. There could be symptoms like pain while passing urine, history of stones, back pains, pain while burning sensation when you pass urine, which could be symptoms of urinary tract infections.
Well, pros and cons in this prospective cohort of adults with cardiovascular disease. We identify an association between elevated plasma to PAR levels and both decline the eGFR and development of chronic kidney disease. This association was observed in patients with normal baseline kidney function and was independent of conventional risk factors of kidney disease and cardiovascular disease, including baseline age, rate, bed expectation, and high sensitivity CRP levels.
Hello again, I'm Dr. Willie Ong. For today, I would like to share you some tips on how to take care of your kidneys. The kidneys are very important. Okay, in this model, these are the kidneys. It helps expel toxins from the body. It forms the urine. It collects in the bladder and it exits the body. Okay? As we get older, our kidneys will also age and they can weaken. And in some cases, this can lead to kidney disease and kidney failure. So you have to follow these tips to take care of your kidneys. Number one, you have to limit your salt intake. If you eat too much salty foods, this will encourage the body to retain water. And if you have too much water, your blood pressure will increase, leading to high blood pressure, which can damage the kidneys. So if you're going to supermarkets, you can choose low salt varieties of nuts. Even soy sauce, there are low salt varieties. For meat products, there are canned meats, low salt varieties. But of course, fresh meat is healthier than canned meat. Okay? Number
And the conclusion of elevated plasmas, PAR levels were associated with density chronic kidney disease and a more rapid decline in the eGFR in persons with normal kidney function at baseline. Well, thanks.